When I was pregnant with Matthew, everything was fine. Healthy, great pregnancy, nothing was wrong. He was born 2 weeks early because I had a C-section. And when he was born, he looked fine. And then when he went to his doctor's appointments, his doctor said, well, let's send you somewhere. His head looks a little funny. So when he was 3 months old, that's when we met Cardinal Glennon, and that's where we met Dr. Lynn and their staff.
When Matthew was a baby, he was born with Craniosynostosis, which is a fairly common condition where the skull bones are fused and requires a plastic surgeon to do craniofacial surgery to reconstruct the bones so that there's space for the brain to develop and the eyes to develop normally.
And the problem with that condition is that there's restrictive skull growth, so sometimes that can result in increased pressure of the brain during development, which can potentially result in developmental delays, trouble with learning and speech and things like that.
The surgery terrified me. To be totally honest, it was like the world could end. I know plenty of people that have lost children, and I didn't want to be part of that.
When Matthew was before 1 year of age, still a baby, he had craniosynostosis surgery, but as he grew, the bones did not heal as completely as they could. And so as he grew older and older, we could see the area became more and more obvious as he grew in size. So much that his forehead had areas where you could see the brain pulsations through the bone that was missing. This was really tough for the kid because he loved baseball and loved sports, and he had to wear a protective helmet while we were waiting for his bone to be thick enough and strong enough for a more definitive reconstruction.
He went for his 1 year checkup, and that's when they found out, hey, we're gonna have to do another one. And Matthew, he's a little boy and he wants to do everything he can. And he couldn't. He was held back. He would wear a helmet at school. Some kids didn't have many friends, made fun of him, didn't understand because he has this big scar on his head. And
they always looked at him, made him uncomfortable.
Mm-hmm. It's hard when your son comes up to you and goes, Mom, is it my fault I'm like this? Or how come God made me be like this? And you just have to sit there and think, it's not your fault, buddy. And God said you're going to be special and you could handle it. You're strong.
I think the parents knew, and we knew, that if he couldn't deal with it anymore, we would jump in earlier if we really, really had to.
As he's growing, he's watching all the boys his age play sports and play and play
Football,
and play, and it's so
baseball.
hard. So we talked to Claire, the nurse with Dr. Lynn, and she's amazing as well. And then talked to Dr. Lynn, and we asked, is there any way that he can play a sport? Because he knew he's going for another surgery, but he's trying so hard because he's getting upset. He goes, you know what? Let me talk to the neurosurgeon. Let me see if there's a way we can make it to where you can play a sport.
Before surgery, the concern was any impact to his forehead could put his brain at significant risk. So as long as he was regularly wearing a helmet, both during batting as well as fielding, we were allowing him to play, but it definitely made him stand out amongst his peers.
So finally, at the last minute, they said, okay, but you have to wear this helmet. And Matt promised, I'll wear it. I won't take it off. I promise. He talked to the coach and told the coach, hey, I want to play for you, but I have to have another surgery in July. He goes, it's going to go good. I know it's going to go good. So will you please hold my spot? So the coach said, okay, well, we'll make sure your spot's there. You can play for us. So he went in and, he had to have the surgery in that July. They used the new 3D model with his, so they were able to use his own bone. They're hoping that if it was his own bone, it'd go great.
Before surgery, this is what Matthew's skull literally looked like. He had a big kind of bat wing kind of defect here. And as you can imagine with the skin covering his forehead, you could just see the pulsations through here. Now, before we had 3D printing, we could try to do surgery, trying to get pieces that match this using sterile paper or something like that. But you can't capture this unique human curve of our foreheads and of our brow region above our eyes. What we did was we 3D printed the defect, which I'm showing you here, and using this as a template. This is not like a piece of paper. It's holding the unique shape of our foreheads, or of, in this case, of a young boy's forehead, and use this to try to find a part of the skull that has the appropriate angle that would match the forehead. This is too big, so what we did was we used our 3D printing center to print this into 2 pieces. And then by breaking them to 2 pieces, we can take this and find exactly where on the rest of the skull, look, this angle is completely matched. And over here, this angle is matched. We can do that during surgery with our sterilized 3D printed pieces. Now I can cut bone from these areas and move them here to get a perfect match. Because we waited for the appropriate age, his bone was thick enough to split, and the split bone, meaning you can double the shape into two, and the original piece goes back to the donor site so that these areas won't have holes either. And that's something that couldn't be done before we had 3D printing, to not only match the shape, but match that unique three-dimensional angle that it has. And so now Matthew has crisp bone in these regions. He's playing baseball.
Surgery went great. It just was great.
We were home in 3 days.
It was a good surgery.